could monoclonal antibody therapy actually be a game changer? Well, a top Delhi hospital, Gangaram Hospital, has said that 2 patients were recovered and discharged within 12 hours after they used this. Joining me this evening is the doctor in charge, Dr. Khosla of Gangaram Hospital. So, Dr. Khosla, tell us about this. Is really fascinating. 2 different patients, different age groups, different parameters, but both out of Gangaram within 12 hours. Tell us about it.
So the first case was of a 36-year-old healthcare worker. He presented with high-grade fever for 4 days, and he had a lot of constitutional symptoms. He had severe fatigue, weakness, body ache, and his blood parameters, his counts were low. They were 2600. His CT already started showing changes. So it looked as if he's going to have an aggressive disease. So we decided that this is the right time when we should target this with the monoclonal antibodies, since they are available now. We saw a dramatic improvement. So within like 6 to 8 hours, the counts improved to 5,400. His fever settled, the mild ears and all the discomfort, and the cough also started improving.
So that was a 36-year-old patient, but also you saw this dramatic recovery in an 80-year-old patient as well.
I want to discuss each case. So this patient we discharged within like less than 12 hours. The other was an elderly man, 80-year-old. He was a known hypertensive, found to be diabetic in the hospital, and he presented with high-grade fever on the 5th day. And along with fever, on the second day of admission, his oxygen started dipping a little. And when we decided, although he had a very good antibody levels, they were 720. So we decided his look is toxic and this is the best window. He is a very high-risk patient. If the disease on the 4th day is already showing changes, so we decided to give him this cocktail on the 5th day, and he also showed dramatic improvement. His oxygen was 98 within a couple of hours. We haven't discharged him as yet. This was given yesterday. We're just keeping him a day extra because he's 88.
Yes.
We would like to all his parameters till now, they are doing good.
That's great news. And we have Anup Razdan, who's actually the son of Mr. R.K. Razdan. That 80-year-old patient is doing much better. Anup, thanks for joining us. Have you seen, when you heard of this dramatic improvement, as Dr. Khosla just told us, what was your first reaction, especially given the fact that your father would have been a high-risk patient because of his age and comorbidities?
Yeah, when Dr. Khosla called me, like, it took me some time to just understand what's happening, and then I knew a little bit about the monoclonal antibodies, and I think they're really definitely, I knew I've been reading about them, and I came to know, I was very sure that the benefits definitely outweigh the outcome of the disease than the risk. So he was 80 and he's 80 and this is definitely a high risk case. So I thought I have to take a call on this, and being in the safe hands of an excellent doctors like Dr. Pooja and Dr. Dhiren Gupta, who were initially handling and who were very, very keen on calling me again and again and trying to convince me that it's very important and we should go for it. He is the perfect patient, and he can have a cytokine storm on the 6th and 7th day. So this is 1 or 2 days window period that one can give him these monoclonal antibodies, and I had to take a call. It took me some time, but then because I trust these doctors and they've been doing a fantastic job.
No, that is really wonderful to hear.
And he's recuperating very well, so I'm quite happy for the time being. So we are observing him. So far everything is fine.
No, but that's really wonderful, because it's so rare that, sometimes when you hear that patients actually start deteriorating so rapidly in the second wave. So,
that was the thing, because looking at his age, now he's around 80, and he is immunosuppressed a little bit because he's my father. I know him much more. So he has had some fungal problems in the last 8-9 years. So I was very reluctant to give him steroids. So this was one thing which really made me take the decision, because they said the use of steroids is almost, you don't need to use steroids.
No, and it's wonderful to see the changes that are coming. But Dr. Khosla, just to ask, I mean, of course, the questions, one is about the availability of it. We know it's available in some Delhi big hospitals, but how fast can it be actually given to hospitals across the country? And the cost is still quite prohibitive. So again, how do we make something which could be a life-saving drug like this accessible to many, many more people? What would you like to say today?
In terms of the disease has been playing around, and we have had lots of mortalities, and families have been wiped out. So the last wave was a bad experience. So this monoclonal antibody, it has come as a pleasant change, because one, the most important factors, to control COVID, we are using steroids. And steroids come with a very heavy price. You, after giving steroids, you are actually immunosuppressing your patient, and you are making them prone to a whole lot of infections, which include bacterial, fungal, and reactivation of certain viral diseases like cytomegalovirus and so many other things. And moreover, you are letting the COVID happen. Once COVID happens, there's a clotting phase, and there's an inflammatory phase, and then because of the therapy, there's an infection phase. And it doesn't end in 2 weeks. It carries on for weeks for most of the patients. So the cost, as compared to the quality of life and the complications and the drugs which are needed, it is not much. Yes, I understand.
No, in fact, I think that's a very important point, because those are the key costs. The cost, of course, there's no cost to a human life, which is the key thing.
Average hospitalization.
And when patients go on ventilators, when they reach that stage, we know the bills that run up in an ICU. So it really is something which can be a game changer. I hope that more and more hospitals can actually use this, which has been cleared now, of course, by our drugs authorities as well. Thank you so much, Dr. Khosla and Anup Razdan. It's great to hear some success stories after all the tragic stories we've heard in the last months. Thank you very much.